To the human eye, this room at Edward Hospital is nice and clean. But if you look closer, you could find millions of microbacteria that could cause dangerous infections. According to the Centers for Disease Control, 1.7 million Americans acquire a healthcare-associated infection each year, with almost 100,000 of those being fatal. So to keep their patients safe here at Edward, the hospital called in backup in the form of 3 new state-of-the-art robots to help clean their patient and operating rooms.
It raises a xenon bulb and it pulses a bulb that is 25,000 times more intense than sunlight. What it's meant to do is disinfect the surfaces and air in the room, especially high-touch surfaces where we know bacteria can linger.
In the interest of safety, the unit cleans when there's no one in the room. A member of the housekeeping staff rolls it in, sets it up, and in as little as 5 minutes, the bacteria that lingered is gone. The light isn't terribly dangerous to humans, but it's deadly to pesky germs.
When that UV light, that UVC light, hits the bacteria, it breaks through the cell wall of the bacteria or virus, and it fuses their DNA, which prevents them from replicating, and so they die.
Edward is the first hospital in the western suburbs to use the robots that kill 5 superbugs, including the MERS virus, that can cause major health problems in hospitals.
We're especially concerned about multi-drug resistant organisms, especially an organism called C. diff.
And those virus-causing bacteria are all over the place.
Any hard surface, especially the high-touch surfaces like phones, computer monitors, nurses' keyboards, that can really harbor a lot of grimy little organisms deep in the nook and crannies, that light can get to it.
With a $125,000 price tag, these machines are a bit pricey. But if they prevent 4 to 5 infections here at Edward Hospital, they've paid for themselves.
If someone were to develop a serious infection, Clostridium difficile, not only does the patient get sick, it costs more money for health care, prolonged hospitalization, more treatment, and more importantly, I think it can save lives.
Edward Hospital has also named their 3 new robots, Snap, Crackle, and Pop. Reporting from Edward Hospital, Whitney Goodbread, Naperville News 17.